911. What's your emergency?
My daughter! Oh God, there's a fishing hook! It's in her eye! Please help us!
Ma'am, I need you to take a deep breath for me. Where are you right now?
Riverside Beach, near the pier. There's so much blood. She's only 8 years old.
Okay, help is on the way. Listen to me carefully. Do not touch the hook. Can you do that?
Yes, okay. But what if she loses her eye? Please, how long until they get here?
Paramedics will be there in 10 minutes. Keep her still and stay calm. You're doing great.
Okay.
2024, Saturday afternoon. I was on my shift in the emergency department. It had been a quiet day so far. Just a sprained ankle and 2 migraine cases, nothing unusual. Around 3:30 p.m., the call came in. An 8-year-old girl with a fishing hook lodged in her eye. I thought it would be simple. Remove the hook, clean the wound, send her home. Routine. But when the ambulance doors opened, I immediately knew this was different. The mother was holding her daughter in her arms, both of them covered in blood. The woman was shaking and crying uncontrollably. The girl's name was Emma, 8 years old, silent, probably in shock. The fishing hook was embedded just above her right eye, the metallic curve sticking out and glinting under the harsh ER lights. "Doctor, please, save her eye," the mother said, her voice trembling between panic and despair. We laid Emma down on the stretcher. I leaned closer to examine the hook. At first glance, it looked like it had pierced her upper eyelid. But something felt wrong. There was too much blood, and the wound's position, it wasn't exactly on the eyelid. It was higher. The mother explained what had happened. They were walking by the shore when someone nearby cast a fishing line. The hook flew through the air and struck Emma's face. "It happened in a second," she said. "Just 1 second and everything changed." I turned to Nurse Sarah. "CT scan, orbital protocol." "Stat." The mother looked confused. "What? Why a CT? It only went through the eyelid, didn't it?" "I just want to be sure," I said, though deep down I already knew something was wrong. The hook was buried too deep. Eyelid injuries don't look like this. I looked at Emma. "Emma, we're going to give you something to help you sleep, okay? You won't feel any pain." She nodded softly. She didn't say a word. She was terrified. When the CT results came in, I looked at the screen and froze. The hook hadn't gone into the eyelid at all. It had penetrated the orbital bone, the bony structure surrounding the eye. The hook had pierced through the bone itself, and there was a small fracture. But that wasn't the worst part. The hook was sitting dangerously close to the infraorbital nerve, the main sensory nerve that controls feeling on one side of the face. 2 millimeters away. If that nerve had been damaged, Emma could lose sensation on half of her face, permanently. And there was another problem. The hook might have broken. Tiny metal fragments could be trapped inside the bone. I had to tell her mother. I turned to her. "The hook didn't go into her eye," I said. "It's lodged in the bone right next to it." Her face went pale. "In the bone? What does that mean?" I pointed at the CT scan. "Here, the orbital bone. It surrounds the eye. The hook is embedded here, and there's a nerve running just beside it. We need to check if it's been affected." I called in the ophthalmology team. We needed the eye surgeons. This was an orbital trauma, far beyond my scope. Dr. Lisa Chen arrived, an experienced orbital surgeon. We stood over the CT scans together, silent, far enough that Emma and her mother couldn't hear us. "Orbital floor fracture," Chen said, tracing the fracture line on the screen with her finger. The bone beneath the eye had cracked, and the infraorbital nerve ran just beside it, a matter of millimeters. "Surgery?" I asked. She nodded. "There's no other option. We can't leave the hook in place. Risk of infection, nerve compression, it has to come out." "How risky?" I asked. Chen hesitated. "If the hook moves during surgery, we could damage the nerve. But if we don't remove it, the risk is even higher. We have to do it," I had to tell the mother. I stepped aside with her, away from Emma. Emma needs surgery, I said gently. We have to remove the hook. Is it dangerous? She asked, her voice trembling. I couldn't lie. Every surgery carries some risk, but if we don't act, it could get much worse. She nodded slowly, wiping away tears. I went back to Emma's bedside and touched her face softly. Emma, we're going to put you to sleep. When you wake up, it'll all be over. I promise. She looked up at me. Will I lose my eye? No, I said. Your eye is fine. Nothing will happen to it, but deep inside I wasn't sure. Because in surgery things can always go wrong. They just do. The surgery began at 6 p.m. that evening. I wasn't in the operating room, but Dr. Chen told me everything later. Emma was under general anesthesia, completely asleep. The OR team was ready. Dr. Chen, one assistant, 2 nurses, and an anesthesia technician. Dr. Chen worked under a microscope. The structures were tiny, delicate, unforgiving. She began by cleaning the wound, making the area sterile. Then she extended the incision, carefully separating each layer of tissue, skin, muscle, fascia, until the hook came into view. It was embedded deep in the orbital bone. And there was a problem. The hook had broken. There were 2 pieces, one visible, one buried deeper inside the bone. Dr. Chen decided to remove the outer piece first. She used fine surgical forceps to grip it, but it wouldn't move. The tissue had already fused around it, holding it tight. She used a scalpel to cut the surrounding tissue, slowly, patiently. 15 minutes later, the first piece came out. Now came the difficult part. The second fragment was lodged inside the bone, just above the infraorbital nerve. Dr. Chen switched to a small rongeur, a delicate bone cutter, and began removing thin slivers of bone to reach it. After 30 minutes, she could finally see the metal glint. It was there, resting right above the nerve. She slid a fine surgical hook beneath it and lifted carefully. The first attempt failed. No movement. The second attempt shifted it slightly, but the nerve moved too. Dr. Chen froze. She waited. Then, on the third try, the metal came loose, cleanly, without touching the nerve. The room fell silent for a moment, and then Dr. Chen said the words everyone was waiting for. It's out. The wound was cleaned and closed layer by layer, muscle, subcutaneous tissue, skin. When the surgery was over, it was 9:30 p.m. Nearly 3.5 hours. Emma woke up in the recovery room, blinking, disoriented. Dr. Chen leaned over her and said softly, Emma, it's over. Everything's okay. Out in the corridor, her mother had been waiting the entire time. When Dr. Chen stepped out and said, we removed the hook. No nerve damage. The woman burst into tears. 4 hours of fear collapsing all at once. Emma stayed in the hospital for 4 days. The first night was the hardest. Around 3 a.m., her temperature spiked, 38.5 degrees Celsius. The nurse called me immediately. We drew blood cultures to rule out infection and increased her antibiotic dose. Then we waited through the night, watching the monitor, hoping. By morning, the cultures came back clean. The fever wasn't bacterial, just the body reacting to surgical trauma. On the second day, we tested her vision. Dr. Chen held up her fingers. How many do you see? 3. Emma answered, correctly. Then she showed her colored cards, and Emma named every color perfectly. Her vision was fully intact. No damage at all. But there was one issue. Emma's right cheek was numb. When I touched it, she barely felt it. Temporary nerve irritation, Dr. Chen said. The nerve was slightly irritated during surgery. It'll pass in a few weeks, she was right. 2 weeks later, the numbness was completely gone. On the third day, Emma looked in the mirror for the first time. She saw the stitches, the swelling, the bruising. I look ugly, she whispered, her voice trembling. Her mother pulled her into a hug. No, sweetheart, you look brave. And the scar will fade. I walked over and said, Emma, that scar should be proud of you because it shows how strong you really are. That day, Emma smiled a little more. By the 4th day, she was ready to go home. The swelling had gone down, the wound was healing beautifully, and her eye was perfect. Her mother thanked me before they left. At first, I thought it was just her eyelid. She said, "But you ordered that CT." I smiled. Sometimes what we see isn't what's really there, I told her. And this case was exactly that. Emma was discharged 5 days later. There was a small stitched scar on her face, but it would fade with time. Her eye was completely intact, her vision 100% normal. Before leaving, her mother came up to me. "Thank you," she said quietly. At first, I thought it was just her eyelid. "But you ordered that CT. If you hadn't..." I shook my head. "It was the right thing to do," I told her. Sometimes what you see on the outside is very different from what's happening inside. A week later, Emma came back for her follow-up. The wound was healing well, no signs of infection. She showed me a drawing she'd made, a bright blue ocean with a clear sky. "I'm not afraid to go to the beach anymore," she said with a little smile. Her mother laughed softly and added, "But we stay far away from anyone with a fishing rod." 3 months later, Emma came back for a full checkup. Dr. Chen examined her carefully. Everything was perfect. The bone had healed completely, the nerve was fully functional, and the scar had faded into a faint line that would disappear even more with time. That day, I learned something important. Sometimes a small injury can hide a great trauma. From the outside, it looks minor, but inside, the damage can be far more serious. Emma was lucky. Just 2 millimeters deeper, and the hook would have hit the nerve. The outcome could have been very different. Sometimes life comes down to millimeters. And sometimes, you're just very, very lucky.